Hello, everybody. My name is Siv Fjellkårstad. I'm the project leader of the National Coordination Project of Adopting Artificial Intelligence in Healthcare Service in Norway. I would like to start with the Norwegian National Health and Hospital Plan, which is the political plan for developing the healthcare services. It highlights artificial intelligence as a technology that makes it possible to offer faster and more accurate diagnosis, better treatment, and more efficient use of resources in the healthcare service. Development and commercialization of new digital tools and medical devices with and without artificial intelligence are important for sustainable healthcare service and must take place in collaboration. The suppliers must develop tools that the healthcare service and patients need to ensure that they are developed in an ethical and human-friendly way. AI is now used in all 4 Norwegian health regions. In the hospitals, probably the most common use case for AI is automation of tasks related to image analysis in radiology, like segmentation of structures in CT images. Another upcoming field for use of AI in Norway is digital pathology. In the municipalities, AI is mainly used in logistics. We also have some sensor or camera-based AI products in use and a robotic seal. Logos of some of the products or vendors providing AI-based products which are in clinical use in Norway are shown here. I will talk about some of these later. The Norwegian hospitals and municipalities have adopted artificial intelligence in various ways. Some aspects of this are whether user and producer cooperate, and if so, how close. Some healthcare institutions produce the AI product themselves, others perform a procurement. Whether the healthcare institutions buy one product or a platform, whether the product is installed at the healthcare institution's infrastructure or another infrastructure, and whether it's a considered choice to procure a product based on AI, or if it is a part of a device or system which is updated or procured. I would like to give you some examples of Norwegian use of AI. Employees at Ålesund Hospital have, in close cooperation with a producer, trained a deep learning-based model for segmentation of CT images of post-breast cancer surgery. The model draws the border of about 20 structures relevant for the radiation therapy. Normally, a doctor spends between 1 and 2 hours on segmentation of all images for one patient. With AI-assisted segmentation, they spend about 10 minutes. The robot seal is an example of a robot where some functionality is based on AI. It's used as emotional support for both restless and passive patients. It has been used for elderly patients and patients with mental retardment. The experience is good. For anxious patients, it has led to reduced anxiety attacks, and passive patients have become more active. Some research has shown that use of the seal raises the amount of oxytocin in the blood. AI using sensor data is used both in hospitals, the healthcare institutions in the municipalities, and in the patients' homes. An example is the municipality of Alta, where it is used for a patient with severe epileptic seizures. Before using the sensor-based product, the healthcare personnel had to walk into the patient's room several times a night to look after the patient, often resulting in the patient waking up and a new seizure starting. Now the healthcare personnel get a warning before the seizure, and they don't need to disturb the patient unless it's needed. The hospital Vestre Viken has acquired a product platform from Philips. The platform contains products which yields the healthcare personnel at the radiology department at the hospital decision support in various cases. I told you about the National Health and Hospital Plan, and as a part of the work on following up this plan, a national and multi-agency coordination project was established in late 2019. The project's main objective is to help and guide the healthcare service so that it can succeed better with safe implementation of artificial intelligence in healthcare. The Norwegian Directorate of Health leads the project, and today 10 organizations collaborate, both organizations in the healthcare service and the health administration agencies. In order to decide how to help and guide the AI projects, the members of the national coordination projects are completely dependent on cooperation, involvement, and input from communities across the country. We therefore frequently arrange workshops and meetings about themes related to AI, like the regulations, how to get data, and ethics. Our philosophy is that when the field is changing fast, it's very important that the agencies have close contact with those who implement AI and therefore have a clear understanding of where the points of pain are. In that way, it's easier for us to reduce or eliminate the challenges which these projects faces. By cooperating with the other agencies in the healthcare administration, we're also able to use our means together and at the same time to reduce the obstacles for adoption of AI. The members of the National Coordination Project are concerned with a good balance between bottom-up measures and top-down measures, and that the healthcare service and the healthcare administration together must find gaps and cover them. The healthcare administration has released an information website this year and established a multi-agency guidance service in late 2021. I will talk more about these measures shortly. Last summer, a bottom-up competence network was established for a broad audience consisting of engaged persons from the hospitals, other healthcare institutions, academia, private vendors, and more. The National Coordination Project has examined several themes related to artificial intelligence during these years and has summarized the conclusions in reports or brief notes. These are the ones from 2021 and 2022. In addition to the reports, the project this year established a multi-agency website to help and educate the AI projects. The multi-agency information website is a package of information relevant for researchers, developers, project leaders responsible for procurement of an AI-based product or staff using such a product. It should increase competence and contains information about the regulations, ethics, how to get in touch with others to share experiences, news related to AI, and more. The regulations part of the website is the best developed part. A multi-agency editorial office will be established this November to keep the website current. The multi-agency guidance service was started in November 2021 as a pilot of giving regulatory guidance on complex challenges. It received good feedback and has been arranged at a regular basis from January 2022. The Norwegian AI environment is not big, so it's arranged one meeting every month. The project seeking guidance has to fill out a simple form with information about the project and legal challenge they would like to discuss. The multi-agency lawyer group of the National Coordination Project then discuss the challenge in a meeting before the regulatory guidance meeting. After the meeting, either the lawyers or the project which has received guidance write a summary of conclusions. We offer guidance both to privately funded and publicly funded projects in the healthcare sector. Our experience is that the guided projects get guidance about their unique regulatory challenges, and the agencies get insights into the challenges these projects faces. We have created a simple process helping AI projects with understanding the laws and dealing with regulatory challenges. The multi-agency information website and the multi-agency guidance service were established to fill information gaps and help the projects using this process. We have a lot of experiences from the National Coordination Project. This is only a few examples. First of all, it has been very valuable to learn from both the other agencies and the AI projects. And even though the Norwegian healthcare services use a lot of products, we expect a lot more activity in the following years. That means that there's a lot of challenges which are unknown now, but have to be solved in the future. We have also some areas of improvement. We would like to get better at the international experience sharing, and we would like to translate at least parts of the information at the information website into English, both for foreign workers living in Norway and for international experience sharing. I hope that this has been interesting for you. Feel welcome to contact us. Thank you so much.